Hello and welcome to Feminine. At the outset, I really wish that all of you and your families are keeping safe and sound in this pandemic. In this video today, I'm going to answer some of the frequently asked questions around the COVID vaccination, pregnancy, and fertility issues. So first and foremost, what is the current status of COVID vaccination for women who are pregnant and those who are breastfeeding? As recently as a couple of days back, that is around the 19th of May 2021, the Government of India has given its approval for the COVID vaccine in the breastfeeding or the lactating women. However, the vaccine has still not been approved for the pregnant women, and therefore, as of now, that is 21st of May 2021, COVID vaccine, be it Covishield or Covaxin, they are still not approved for the pregnant lady. However, those who are breastfeeding can go ahead and take the vaccine. Now, the next question is, if you have recently recovered from a COVID infection, then when can you take the vaccine? So, as per the latest guidelines that have been issued by the Government of India, you should wait for 12 weeks, that is 3 months after you have recovered from a COVID infection, before you can go ahead and take the vaccine. The next question that many women are asking these days is it okay to plan a pregnancy in the ongoing pandemic? So it's a slightly tricky one to answer. Whether or not to have a pregnancy in the current situation is ultimately a very personal choice. However, you should be mindful of certain things. First is that, in the current situation of pandemic, the accessibility to medical care is slightly limited. The accessibility to ultrasound scans is also limited. Also, during pregnancy, although the pregnant women are not at a higher risk of getting the COVID infection, but if they do get an infection, then they are slightly at a higher risk of developing the more severe disease. They are at a slightly higher risk of needing hospitalization and so on. Now, answering the second part of this question, what are the complications of having COVID in pregnancy? So, as more and more cases of COVID in pregnancy are being seen in the second wave of this pandemic, more and more observations are getting collected. It has been seen that the risk of miscarriage has increased with COVID infection in pregnancy. Also, the risk of the mother developing high blood pressure, the baby's growth lagging behind, that is, the baby will be small and the water level around the baby may drop down. That is also being seen. Sometimes women, when they are themselves moderately to severely sick because of COVID and have very low oxygen saturation, even a sudden death of the baby inside the mother's womb has been seen in a few cases. So yes, having COVID infection in pregnancy, particularly if the infection has developed in the last 3 months of pregnancy, and if it is a moderately to severe disease for the mother, then there can be significant complications for the pregnancy because of COVID. The next question is, are pregnant women at a higher risk of getting COVID infection? And if someone develops COVID during pregnancy, then what can be the risks? So, answering the first part of the question, pregnant women are not at a higher risk of getting infection versus the general population. But if the pregnant women do get infection, particularly if they get the infection in the last, that is the third trimester, in the last 3 months of their pregnancy, then their chances of having a severe infection, wherein they may require hospitalization or they may require an ICU admission or the need for a ventilator, the risks of developing those complications is higher versus the non-pregnant population. Next question. If I or my husband have recently recovered from a COVID infection, when is it safe to start planning a pregnancy? So again, we do not have very concrete evidence giving an answer to this question, but it is a good idea to wait for at least 8 to 12 weeks after you have recovered from an episode of COVID, either you or your spouse, and only after 8 to 12 weeks of recovery from COVID, you should go ahead and plan for a pregnancy. Also, be careful of the fact that considering the impact this infection is having on human lives, you may want to take the vaccination before you actually plan the pregnancy. Because we know that as of now, the vaccine cannot be taken once you fall pregnant. And so, weighing the risks and the benefits of not taking versus taking the vaccine, in my personal opinion, if you've recovered from an episode of COVID, wait for 12 weeks. Register yourself for the vaccination. Take the vaccination, and only once you have finished your vaccination schedule of 2 doses, after that you should go ahead and plan the pregnancy. The next frequently asked question is, what is the ideal time interval between the 2 doses of the COVID vaccine? So yes, there have been a number of revisions regarding this time interval between the 2 doses. But what is the latest is that the time interval between 2 doses of the Covishield vaccine can be up to 12 weeks, or rather 12 weeks is what is recommended in the most recent guidelines by the Government of India. And for Covaxin, the time interval between the 2 doses can be between 4 to 8 weeks. The next question is that I have recently completed my 2-dose schedule of the COVID vaccination. When is it safe to have a pregnancy now? So the answer would remain the same. Whether you have had a natural COVID infection and developed immunity, or you have taken the jabs for the COVID, that is, you've taken the COVID vaccination, in either situation, wait for at least 8 weeks after the infection or after having taken the immunization, and after that you should go ahead and plan your pregnancy. I hope that some of your queries have got answered through this video. Please feel free to drop in any questions or doubts if you have regarding the issues of COVID and fertility. And stay safe, stay healthy. Take care.